Hi, everyone. Welcome back to the Passionately Wrong podcast. I'm here with my partner, Randy, and today we're going to tackle a pretty big topic, which is healthcare. And we know there's lots of different angles to this topic, so we thought we'd start with one that we have some personal experience with, which is the difference between how healthcare is provided in the United States versus some other countries in Europe. I think probably the first and biggest difference is, for a long time anyway, whether healthcare was maybe universally provided or whether it was something that a person had a choice whether to pay for private insurance or not. US supposedly now is moving in the direction of socialized care or universal care, let's call it, with Obamacare. But there's still quite a few, many millions of Americans who are not covered and others who are covered in different ways. One of the ways we might get to later is the difference between government provided healthcare, either military, which I assume you'll know about, Randy, or the care that's provided to people with disabilities or above a certain age, Medicaid. But for most of us, it's a question during our working lives. For example, it's a question of, does your company provide you with healthcare? Do you have to pay for it and provide for it yourself? And then, yeah, this general dynamic, how does healthcare differ between the US and Europe? So, what countries do you have some experience with in the meantime, Randy? And then I'll give you my list and we can do some compare and contrast.
So I really only have experience kind of with internal knowledge, like the people that I associate, family and friends in Romania, and what their reactions to it are. I do know something of the UK system because I have friends there, and I also helped edit a book written by an American doctor who was working in the UK for 5 or 8 years, and he wrote a book specifically about the difference in the two. That's kind of interesting. And yeah, those are the two. I mean, I have some experience in South America with their social system and their private system, but I was under a TRICARE, military system that covered all my medical emergencies while I was down there. So I didn't see the financial aspect of it. So I don't know much about that in South America, but I know about what to expect in the different private and public care systems.
There's talk about the cost of healthcare. I have experience, probably the most experience, in the markets that are routinely listed as the two most expensive markets for healthcare, and they would be Switzerland and the United States in terms of the amount of money that individuals spend and that the country spends per capita on healthcare. Those two are always right at the top. I think Switzerland's actually even above the US. One question is, well, okay, are those statistics really misleading? So if you take Spain, for example, where people are residents of Spain are covered by the national healthcare system, and the cost of going to the doctor and getting some kind of procedure done is a fraction of what it would be for a person in the other countries, either out of pocket or paid for by their insurance company. And does that mean that healthcare costs a tenth of what it does in Spain? A tenth less in Spain than it does in Switzerland or the US? Not really, because someone's paying for it somewhere. At least, part of the tax burden for people who live in Spain goes towards paying for healthcare. It's just done in a different way. That's probably gets rid of half of the cost differential. The other half, though, does reflect profits and inefficiencies, let's just say. Part of the reason healthcare is so expensive in Switzerland is because everyone's salaries are relatively high. So it just genuinely costs a lot of money to do something that's so human intensive. Part of the reason healthcare costs are so high in the US is that there is a tremendous amount of waste and fraud. A lot of people are getting wealthy off of the healthcare industry, but in ways that are not delivering good results to patients. So I don't think we're going to spend a lot of time talking about the whole, social cost of healthcare and why it seems so cheap in some countries where there's national healthcare versus in other countries where it's paid for differently. I just wanted to leave maybe a thought in people's heads, listeners' heads, that, well, okay, you are paying for healthcare, whether it comes in the form of taxes or whether it comes in the form of insurance or out of pocket costs. You might be paying extra if your country doesn't manage it well or efficiently. Like I think no one would argue the US does, but it's maybe not as extreme as the headlines would have you think.
So I've spent the last 5 years, almost 10 years now in Europe. but 4 of them were I was in the military. So I'm not really counting those since I didn't have anything to do with the medical care system. But the last 5 years for sure, I've actually tried to move to France, so I had to get familiar with what was going on over there. I think there is a misconception in the United States that everyone in Europe is experiencing a really well-oiled social health system in their countries. And that's not true at all from my experience. Some countries are doing it better than others. I don't know. Every country has a different price tag on it as far as each individual pays, above their taxes. They pay for Social Security, some kind of Social Security, and they pay for some kind of social health care thing on top of it. And usually all that added together is going to add probably maybe 50% of your salary, more or less, something like that. It's kind of nuts, maybe even more than that. I just talked to a Spanish attorney, because I was planning on moving there. I said, how much is healthcare? And he's like, it's 80 euros a month to start out with, but it goes up to 500 a month the longer you stay here until you get your residency. So 500 euros a month sounds like a lot. And I don't know if I have to dig into that and find out what that means. I personally, as a retired military, I pay $100 a month and 200 if I want my family included, which is pretty cheap for what I understand in the United States. So all that's interesting for Spain. For Romania, they pay a large percentage, and the company they work for pays another percentage of their paycheck, and they never see either. It just goes straight out of their paycheck. They never see it. And from what I can see, and from what I've heard from my wife's family members and other friends that we have here, the social system is to be avoided at all costs. If it's a social healthcare hospital here, the joke is you're not coming out, which I don't think is completely true. But I have seen like her grandmother wait in a waiting room with a stroke for 5 or 6 hours before someone looked at her. So I know it's not rushed. And I know I see a lot of TikTok videos and other reels on Instagram and stuff from people living in Germany saying, this is the best thing ever. Why can't the US do this? It was fast, it was efficient, it was perfect. I see that a lot on Facebook from veteran groups that are living in France and Western Europe. The thing is, most of those guys are retired and they didn't pay into the system their whole life, So they're paying off of their retirement income right now, which is a lot less than what they were making in before they retired. And a lot of times some of that stuff doesn't even get taxed by that country because of if it was a government retirement or something like that, they have an agreement with the countries where they're not going to tax your government retirement. Only the US taxes it. So that in some cases, they're not paying anything because they're living out their retirement there. They're not paying into the health system and they're getting, free healthcare. The only other experience I have is my father, who has walked the Camino de Santiago with me, had a really, really bad blisters and infection in his foot. And went to, they have along the route, they have some emergency rooms, kind of small emergency places where people can look at their injuries. And they said, hey, you need to take a break for like 4 or 5 days. And here's some medicine. And here, he's like, how much? He's like, yeah, we don't charge for that. You don't get charged for emergency care here. It's free. It doesn't matter if you're a resident or not, which my dad was like really surprised and is a nice function of a social system. But I just don't think it's all as roses as everyone thinks in the United States. Because I hear people quoting the United States all the time, like Europe's perfect and it doesn't. It's all free, and I don't. It's not always great though.
Yeah, so there's a couple of things to unpack there and maybe highlight, Randy, which I think illustrate your point. There's quality of care, there's cost of care to the individual, and then there's the method of how you pay for it. And starting with the latter one, socialized medicine usually requires a pretty high tax burden, and it requires broad participation. So everybody has to pay into the system. In Switzerland, you are required to have insurance, and they don't mess around. There's no voluntary certification on your tax form. Oh yeah, I have healthcare. You really do have to have it, and they'll check whether you do or not. And it's expensive. And it's interestingly, in Switzerland, largely paid privately. It's not a company benefit for a lot of people. It's you got to go and get it. but it's extremely regulated. So the government sets the rates and you can go and join different private companies, but the cost of your basic insurance is going to be the same no matter which company you then go work with. Similarly, the cost of all of the procedures, if you spend so and so much time getting an eye thing done or an arm thing done, this is how it's going to be charged. So you don't get a vastly different price or even a slightly different price whether you go to Dr. A or Dr. B. I'm exaggerating a little bit, but that's largely how it works. Everyone pays, there's some regulation on how much it costs, and then everybody knows exactly how it's going to work. It's expensive, but it's transparent and everyone participates equally. That means the quality of care, people don't realize this always, but I think it needs to be said. The quality of care is a function of how much people are willing to pay. If the UK wanted better services for their national health service and they wanted to have straight teeth and appointments in less than 9 months, they would pay more for it. And that they don't reflects the society's priorities. It's an imperfect mechanism. It's slow, but for socialized medicine, the level at which you are happy or not happy with your care reflects how much society has said, this is how much we're willing to pay for it. And so the payment comes either, as we've said, either directly from you out of pocket or indirectly through your paycheck. And so the issue you mentioned about retirees moving to a European country and getting the benefit without necessarily having paid into the system all their life, that question of do does the system allow free riders or not, and under what circumstances is a really important one because the costs are high. And by the way, when it comes to costs, if you think about it for just a moment, they're legitimately high because you've got doctors who spent an inordinate amount of time training to become and remain experts. You've got the medicine and drugs that are made available to people, and the costs of developing those are legitimately high. You've got equipment, machines that costs tens of millions of dollars. All of that stuff has to be paid for by somebody. So when we're complaining about $200 a month or a $20 copay, it's important to remember how many fixed costs there are in delivering healthcare. So the question of free riders, of a person who says, I'm healthy now, why should I pay for insurance? I'm going to wait until I have a need and I'll pay only specifically for that need. This is one of those tricky issues where your individual decisions have a society wide impact when you add up the individual decisions of a whole bunch of people. So if you get 50% of people who have no need of healthcare at any given point in time saying, I'm not going to pay for it until I need it, well, in effect, that doubles the costs for the people who are getting healthcare at that moment in time, if you understand my simple math there. So that's maybe a long way of saying quality of care and cost of care are related, and how much a society is willing to pay and how strongly they're willing to enforce that everybody pays for the healthcare that they get will all have impacts. It's so interesting to contrast for me Switzerland and the US, where in Switzerland, as I mentioned, everybody pays and there's not a lot of evasion. Whereas in the US, I still get the sense that there's very different approaches to healthcare. Let's take Obamacare subsidies, for example. I know people who are wealthy, but who have managed to get their healthcare subsidized basically by manipulating their income or characterizing it as certain amounts of this. And up to a relatively high income, you can get a generous subsidy on your healthcare payments if you go through the Obamacare system. I find that I understand the motive for doing it. You want to encourage people to get health insurance so that ultimately you have fewer free riders. And if it requires subsidizing them to get them into the system and used to paying it, you can always adjust the subsidies later. I'll toss out a few numbers just to make you feel better about what you pay, Randy. I am paying more than 10 times what you are paying monthly for healthcare for just me and my wife. I have a high deductible plan in the US. I have to spend $20,000 out of pocket before I get any benefits, and that costs me $1,200 a month just for that US plan. I have an additional private insurance on top of that, which means I can actually go see a doctor, concierge medicine or private medicine. That's not so bad. That's an extra 300 and something a month. And then I've got still Swiss insurance because my wife doesn't totally trust the US system. So we have some doctors we go to in the US. So anyway, I'm spending more than it's a crazy amount of money now that I talk to you about it on healthcare, for which I admit to almost never needing, right? Healthy, fit at the moment. This is insurance in the true sense of the word, that you pay for it. You hope you don't need it. And I justify it in two ways. I say, all right, I can afford it. And it is, I don't want to be a free rider. I know everybody has to participate in the system for the thing to work. So I pay more. But then it annoys me, right? It annoys me when I see free riders and I see other people scamming the system in effect. Anyway, so that was a lot. I'll stop there and let you add something. And otherwise I would turn to messed up incentives if we're going to talk about some of the passionately wrong incentives here. I just mentioned one, which is for people not paying into the system if they can find a way not to. There are other incentives that make the delivery of healthcare less than optimal, but go ahead.
So I forgot to mention that, I've never used social medicine here, but I've used the private sector and it's been significantly affordable. Like every time I go in there, I was like, really? $15 to get seen by a specialist and get a sonogram? That's amazing. And even, that's not affordable on probably most people here. I think the average salary here is like $400 a month or something like that. So, that's, 5% of what they're making or something. My math's probably off, but I have no problem going there and paying $15 to say, hey, is this a hernia? And what do I got to do about it? Now, I haven't got any major surgeries done here. I have no idea what they would cost. I went back to the States and got them done through my VA, which is free. But I did get checkups, sonograms, and various other usually expensive procedures done just to see what's going on so I could go back to the States and get it taken care of if I needed to. Now, one thing that's interesting to me is when I read this guy's book, this US doctor who worked in the UK, his conclusion was that it was an attitude. There's two attitudes in the United States that make it difficult. One is I'm going to sue you because you didn't do something right attitude, which, raises insurance for all the doctors who don't actually, you know, if they lose it, they don't necessarily always lose their license. The insurance company pays out, and so are you really making the doctor suffer? I don't know. But so there's that kind of culture of, bringing people to court because they think that something wasn't done correctly in the doctor's office or in the surgery room or something like that. And then the second one is I deserve everything to make sure that I'm healthy right here at this second. And by that, I mean, I should get an MRI, an EKG. I should get every blood test known to man, because if you don't catch it, I'll sue you. And even if what your symptoms, you come to me as symptoms, don't necessarily necessitate it, or it's very unlikely that you have it. In the social systems, at least in the UK where this guy worked, he was like, they have protocols. If you come in with a cough, you get the following things. And if the tests come in negative, you just get this and you move out. And if later on we found out that cough was the start of cancer, you don't come back and sue the doctors. They followed protocol, and it was very unlikely it was cancer because all the tests came out positive. But that's why we didn't do the further ninja cancer detecting test, which costs $1 bazillion, as opposed to the United States where, oh, he has a cough. Well, it could be cancer. I mean, it's like 0.00001%, but we might as well get all the tests. Otherwise, if we don't detect it, we could get sued. I'm sure it's an exaggeration, but I'm not sure it's an exaggeration by a lot. The protocol, the social medicine protocols are like, this is what you get. This is the medicine you get. Come back if this happens, and then we'll address it with a new protocol. In the US, it's like, I got to figure out every possible test that can possibly detect what's wrong with you, even if it's unlikely, super, super unlikely. And the test costs a lot of money, and the specialist costs a lot of money. And that's why insurance costs a lot of money.
We've observed that coming back to the US and getting healthcare here, that there is an extreme sense of leaving no stone unturned. Even for young, healthy people, the number of tests that they will send you to go get, and blood work and MRIs, and really, really unusually and noticeably more than in social medicine countries. And I would say, people talk about rationing care and death panels, and see, that's why we should never adopt social medicine. And I think it reflects a cultural attitude. One is in every other area of our lives, we do ration and set priorities. We say, all right, I'm going to spend so and so much on this category of expenses, but I'm not going to, try to optimize to the last tenth of a percent. It's extremely expensive to do that. And it is absolutely, I think, personally, as a lawyer, I can say this, a reflection of the litigation happy culture that exists here. It is very easy to sue someone for malpractice, and it absolutely drives conservative behavior and over medication, over testing, things like that. Absolutely 100%. I think that is a factor. And by the way, that is a reason why it is risky to just compare one element of a country's healthcare system with another country's system. There's a lot of the basic culture and background and expectations that have built up over, decades. That means it's not so easy or quick to make a change, even if people want to make a change. So another cultural aspect I would mention, Randy, is what I was saying before about cultures and people setting priorities. My daughter's just about done with med school in Switzerland, and I am happy she went to school in Switzerland because the cost of her education is a fraction of what she would have paid in the United States because the state pays for it. In other words, taxpayers pay for it. I'm paying for it indirectly, but it's one of the priorities that society has set, which is if you go to university and you go to medical school, it's only going to cost you $2,000 a semester, not $100,000 or whatever it costs to do so in the United States. And that also has an impact on the cost of care. Doctors don't come out with several $100,000 in debt. So it's okay for them to earn a slightly lesser salary because they also get to keep more of it because taxes aren't so high, medical malpractice insurance isn't so high, and they don't have school debt. So a lot of little choices, the whole system, the whole culture of how that country approaches healthcare have impacts that run all the way through the system. What it also means when you start to look at a problem as complex as healthcare in this way is it's interesting to make these country comparisons as we're making, but really what it reflects is deep cultural and historical differences that aren't so easy to fix. What advice do we have, if any, as we talk about this and hear ourselves? What would we say to people about how to successfully navigate their healthcare environment? I do know people who have moved countries who said, healthcare costs so much in the US. I'm out of here. I'm going to Spain. I've got a couple people I know who have done that. And whether or not they're slightly being free riders, it's an option that's available to them, right? Cost of living is less, cost of healthcare is less. It seems to be decent healthcare. That's one option, I guess, that has to be on the table for a certain type of person. But any other thoughts that you have about, we haven't gotten into the whole military versus not healthcare yet. We might do that in a second part, but what
So,
comes to mind?
so one thing that comes to mind, I can't really forget what this book this guy wrote about comparing UK to US. And the other piece of the puzzle in the US is we're always using the newest drug, that supposedly will do better. And the studies have said that the newest drug might give you a little bit more time if you're on, especially if you're kicking death's door down or something. The newest drug might let you live longer, month, maybe a year, but month, a week, whatever. But will it give you a better quality of life? And that's one of the things that I think some of these social medicine countries take in accordance to. And also what that he was saying. In fact, he wrote a fiction book that followed up with his nonfiction book, which was to kind of show how big pharma promotes all these new drugs about whatever, whether it's cancer or diabetes or whatever, heart, something about your heart disease or something. And is if it costs $500, 500 times more than the last iteration of that drug, but it might let you live 2 weeks longer, except won't be able to move and you won't be able to do anything. And what happens if we got the best drugs and now you can live to be 120, but for the last 20 years, you were just sitting in a bed with an IV in you and you had no brain function or something, barely any brain function. And then we don't have, the choice to say, I don't want that drug at some point because someone else becomes responsible for your medical care in your family and makes those decisions for you or something like that. So that's one thing that he was very adamant about explaining in both of his books and trying to to give it a kind of bring it to light. Now, the other thing, I've been watching this mini series. It's on that conservative channel, I can't remember what it's called.
Daily Wire.
Yeah, the Daily Wire. So Candace Owens has a series called Shot in the Dark. And she doesn't call herself anti-vax because she claims she's doing the research, and she's not pushing anti-vax on anyone. She's just saying, this is what I've discovered. And please, anyone who has different knowledge and can back it up, please send it to me because I want to be right. And so in a way, it's a really good way to present an argument. And most of her arguments are about in the last 20 years that all the vaccinations for children have gone from like 3 vaccinations to 23 in the first 6 months. And what is that doing? And some of the vaccinations are like Hep B, which is caused by bad blood and sexual disease, contact with someone who has Hep B. So why are we giving a 1-year-old the Hep B vaccination? And why are we protecting them from these things instead of waiting till their immune system gets longer? And so the main thing I learned about this is not just vaccines, but anything is, learn more about what you're doing and what you're gonna take. Like if the doctor's like, here, take this medicine, I hope that all doctors got their best interests for their patients at heart. They rarely explain like what the difference between Generation X and Generation 2 is and what the big difference is. The price tag's a lot different, but what's the risk of me taking this over this? And I think that there's enough information. I mean, a lot of the information is just in the handouts and the packets of the medicine that you can look at. The one thing I just learned from her series is just kind of like read everything you can about it before you, and then question the doctors about it, which a lot of the doctors that she questions seem to be insulted that they're like, you're not a doctor. Why are you talking about this? I was like, well, are you an expert in everything? Because I don't think I've been in the medical arena and it's hard to be an expert in everything. But anyway, that's what I have to say. I hope it's not too controversial, but.
Well, I'm going to add to the controversy, but I'd like to expand and emphasize your last point. No one cares as much as you do about your health. That doesn't mean you're going to be an expert in everything. It just means that as it relates to your knee, your shoulder, your health problem, you are absolutely 100% the most motivated and the person who will be willing to put in any amount of time and not give up till you get an answer that you're happy with. And what that means is you should consider yourself to be a highly capable participant in discussions about your own health. You can research, you can ask questions, you can, by the way, simply raise doubts when something doesn't sound right to you or feel right. It's appropriate. We always talk about getting a second opinion, but it should start with just asking sensible questions to your doctor. You're not challenging them or their expertise. You're just saying, hey, I'd like to know more about that. Is that the best one? Is that the only one? Is there another way? Are there other methods? Doctors, as I hear them describe their practice in the US, a lot of them are not so happy about the amount of time that they get to spend with each patient versus filling out paperwork versus doing, administrative stuff. What that means is they often go for what is likely to work for that patient. First of all, as we said before, I'm going to prescribe a million tests so that if there's anything that gets revealed by those tests, it costs the system a ton of money, but at least I'm covered. And then they're going to recommend the quick, easy, this is the drug that everybody recommends. It's the latest drug from Pfizer. So I'm not going to get sued for prescribing this to you because that's that's what you're supposed to do. Whereas if there was more time and if you asked the question, hey, is there a generic drug? Is there, by the way, an intervention that doesn't involve getting on a drug that I need to take then for the rest of my life? In the United States, people of our age in their 50s, Randy, are on an average of at least 5 prescription drugs. And that's a scary statistic from my perspective. The most eye-opening thing that are coming back to the US and getting into the US healthcare system for me has been a really stunning and depressing revelation. And that is that pharmaceutical companies do not have patient well-being as a primary goal. And that sounds so counterintuitive. You say, how can that possibly be the case? I wrote an article about it, which is how come more pharma companies aren't organized as nonprofits. They are profit oriented. And what that means is their best patient is one who is prescribed a drug and needs to stay on that drug for the rest of their life. They don't want to make you well. They want you to take their drug forever. And the standard for getting a drug approved in the United States is it more efficacious, even a tiny bit, than not taking the drug? The comparison is not, does this drug work better than any other method? And by the way, some of the other methods that might work much better are lifestyle changes. So you, the patient, deciding to get more exercise, to eat better, to lose some weight, to focus on your stress, to improve your relationships, et cetera, et cetera. There's a whole list of lifestyle interventions, I would say, that if they were done well and promoted as much as the drugs are promoted in TV and advertisements, you might find a lot of people not needing to take a diabetes drug or a stress hypertension drug or high blood pressure. And that's not in anyone's interests when it comes to the profit motive, right? The pharma company doesn't want to promote that and won't promote it, and they're not required to. They're not required to show that their drug works better than another method. And that is a mismatch of incentives that I think drives a tremendous amount of suboptimal care in the United States. The way I want to tie it back in is to say no one cares as much about your health as you do. So the question should not be, is this the right drug for me to be taking? The question should be, what is the best treatment for this particular condition? Maybe it's a drug, maybe it's not. And you won't always get that answer from your doctor. I heard a doctor who just graduated recently saying, and I've heard this in other places. I don't know if it's true because it sounds shocking. The amount of training you get in medical school on nutrition over the course of your 12 years of study is something like an 8-hour course. You get 8 hours of nutrition advice. Really? Really? That's how important we think nutrition is to your health. I mean, as a layperson, I find that to be suspicious. Now, we've talked in other episodes about nutrition. I think we have anyway, and about how hard it is to get good advice, but still. Anyway, so my point with all of that is you're the person who is in a position to be the best advocate. And you might find that the medical profession has incentives that are not aligned to your own, which is to get well and to be healthy. Theirs are to extract money from you, unfortunately. And
Yep.
the real irony is I know a lot of people who are very proud of working for a pharma company, working in the medical profession because they feel like they are doing something noble, helping people. And of course, many of them are, but there's a lot of mismatched incentives that I think distort how healthcare is delivered in the United States, at least.
Yeah, I agree.
Okay. All right. So other advice that we would give to people, in case it wasn't clear, my advice to you as a result of that rant a moment ago would be to not only care more, but to pay attention to your own fitness. So really, whatever method of eating works well for you, find one that doesn't contribute to your becoming an incipient diabetic with metabolic syndrome. Get enough exercise which brings many, many, many benefits as a general rule. Be active every day and delay as long as possible your need for intensive medical interventions. Not everyone can do that, but the longer you can stay healthy by virtue of things that you do yourself, your lifestyle, I think the happier you'll be, the less medical attention you need, in other words.
And I think don't be afraid to be your own advocate with, if you want to be the Google Doc. When I was hanging out in the hospitals and with doctors and stuff, there was kind of jokes about people bringing in their Dr. Google, papers going, what about this? What about this? But here's the thing. Stuff changes all the time. There's things happening in other countries that doctors don't have enough time to read. There's nothing wrong with being your own advocate, doing your own research on what is wrong with you based on, what the doctor said, what your labs say and things like that, and bringing it to someone's attention. And there's nothing wrong with changing doctors. Not because he disagrees with you. I would expect if a doctor disagreed with you, he would have a reason. He would say, hey, this is why I don't think it's that because your level's here and that and this, and kind of go through it. But if he doesn't have time to do that, maybe he's not the right doctor for you, or he or she. Maybe you need to find someone who's willing to have a discussion. But it's your life and it's your health, and you should take responsibility for it.
All right. So that's probably a good point to stop this episode, Randy. And I think if we're still motivated, we could talk about the difference between the care that's offered to military versus the care that's offered to private persons. I know I have some questions and probably some myths in my mind about the quality of that care. You see some scary articles. But yeah, let's save that for a follow-on episode. And hopefully you guys got something useful out of hearing about this. And if you have questions or comments, let us know. We read and respond to them. And thanks for listening.
Thanks, guys.
We'd love to hear what you think, so please comment on the show with your thoughts. We read all of your comments.
Thanks for joining us, and thanks for subscribing. See you next time.